Good evening, everyone. So this acupressure certificate course is organized by Bodhi Yoga Institute, and it is very reputed institute of the South India and having many branches in Hyderabad, Chennai, Bangalore, and many places of the South India. So I am very thankful to Swami Ashok ji and Natasha ji for organizing this workshop. And this is the 15 days workshop. So let's start now. And this is workshop of the acupressure. We are not going to learn acupuncture in this 15 days. And during these 15 days, our main focus will be the very, very common diseases which is happening in the daily to daily life. Like in the daily to daily life, we need to improve our immunity. We need to, so that we can fight from the infections. We need to know how to release the back pain, knee pain, cervical pain, spondylosis, gas, acidity, indigestion, ovarian problem, infertility, depression, diabetes, overweight. So these all problems. So we have made the very common list of the all problem. And during these 15 days, we are going to learn and we are going to discuss these common diseases. So when we talk about the acupressure is made by two words, acus. The meaning of acus is the needle. This is the Latin word. And the meaning of pressure, to press some point. So this acupressure is very simple word. When we remove the pressure and put the puncture, then it becomes acupuncture. In the pressure, we are pressing the point, but in the puncture, we are putting the needle on the points. So before proceeding, I would like to know, am I audible clearly? Good, thank you. So now, in the human body, we have uncountable microsystem. Uncountable means, and what is the meaning of microsystem? The meaning of microsystem, like this is the full body, and we can do the imagination of full body just in the small part. Like we can do the imagination of whole body in the ear. We can do the imagination of whole body in the arms, in the palm, in the finger, in the feet, nose, eyes, face, and scalp. You will be surprising how it's possible to do the imagination of whole body in the small ear. So if you know, there is a very famous therapy that is called ear or auricular therapy. Ear acupressure, ear acupuncture, or the auricular therapy. In this therapy, the ear is doing the representation of whole body. So just why 108 point and few more. You can treat thousands of diseases just by doing the acupressure in the ear, because ear is representing the whole body. So that's why when in the Gurukul, student doing some mistakes, so master are pulling the ear, because master are knowing the brain will be in the lower part. Nowadays it's not possible, because if the master will pull the ear, then parent will come to fight. But in the Gurukul, it was tradition. Even they were giving the punishment. If the kid is not performing well, then the kid has to hold the ear for some time, and by holding the ear, the kid will be stimulating the brain. So it is a very good point to enhance the brain. But not only the brain, we can treat each and every problem just by the ear. This is called ear therapy. So we can see the whole body is just in the ear. Now, if we talk about the arm, even in the arm, we can do the whole body representation. So this is representing the upper part of the body, like we are having eyes, nose, and mouth. This is doing the representation of the chest cavity. And this lower part is doing the representation of abdominal cavity. So hand is also doing the representation of whole body. In this way, if we do the acupressure here every day, So we can improve the health of our lungs and heart. And we know what we know. Lung is the governor of energy. Lung is the governor of energy. If you want to improve the overall energy in the body, then you have to stimulate the lung. So the governor of energy will be lung. So it has been told. Excuse me. Yeah. So it has been told, if one person is doing the acupressure only in this part, means if the one person doing acupressure only in this part every day, and this will keep away aging, and this acupressure will improve the energy level, will improve the vitality. So just you have to do the acupressure here in this part. We will do the practical demonstration how to do that. So just by doing the acupressure here, sometime we might feel this part is very hard like a hard leather. If you are observing and experiencing this part is very hard like leather, it means the person will become old very fast. So what to do now? You have to do the acupressure here so that you can remove all the blockages. Energy will flow very freely from the shoulder to the finger, and we are doing something in the arm, but with the help of arm also we are making the energy flow better in all over body, top to bottom. So this is also called anti-aging point. So it means the arm also doing the representation of whole body. And in this course we are going to learn many points. In the palm we are having eyes, we are having nose, and we are having mouth. So this arm is doing the representation of whole body. So this is called arm microsystem. Let's see now. And we already know the hand or palm is also doing the representation of whole body. And just by using the palm, we can treat any disease. And this is called hand microsystem or Sujok. Sujok is a Korean word. The meaning of Su is the hand, and the meaning of Jog will be the feet. So what is the meaning of Sujok? The meaning of Sujok, when you are using the hand microsystem for doing the treatment of any problem, this is called Sujok microsystem. So it means we can also choose the palm or feet for doing the treatment of the whole body. So whether we have to take ear, or should we take arm, or we should take the palm. So the answer is this, it's your choice. You can expel the disease from any microsystem. Whether you use the Sujok or the arm or the ear, you can expel the disease. Let's see a few more. Even you can see this is the ant, this is the ant, this is the ant. Like we can see ant here, the head in the upper part, middle part is the body, and we can see legs and lower part here. In the same way, if you look any of your finger, the finger is doing the representation of whole body like the ant. So just by finger, you can treat the eyes, throat, lungs, heart, genital part, large, small intestine, liver, stomach, everything. So this is the beauty of microsystem. Just by finger or any finger, either the index, middle ring, or small finger, or the finger of the palm, or the finger of the feet, you can treat any disease. So this is called finger microsystem. Keep on looking here. Now look at here, this is the scalp. If you see the scalp, even you can see the female are putting the red color sindoor here. Why? Why the female are putting the red color sindoor here? Because as per this image, you can see this is the brain. So when the female are putting red sindoor here, then it is secreting the dopamine hormone from the brain. So when the female put the red color sindoor here after marriage, it is very helpful to secrete the dopamine hormone from the brain. So when the dopamine hormone will be higher, and the female will not be sad, because dopamine hormone is responsible for making your mood good, and you will be feeling lots of pleasure if the dopamine hormone is good. So this is skull microsystem. So in this way, this is just the introduction. So your mind should open, your mind will open how the body is. In the body, we are having more than 10,000 microsystem. That's why I have written uncountable microsystem. You can see this is the chest bone or sternum. It is also doing the representation of whole body. This is the abdomen. Abdomen is also doing the representation of whole body. Just by abdomen, we can treat any disease, and it's called abdominal microsystem. Face also doing the representation of whole body, and it is called face microsystem. So what is the meaning? As per the microsystem concept, each and every long bone, each and every long bone is doing the representation of whole body. So why any bone of the human body, any long bone of the human body, you can treat any problem, where either it is in the brain or in the spine or in the abdominal cavity or anywhere, because each and every long bone is doing the representation of whole body. So this acupressure subject is a very vast. So let's make it very simple. Let's make it very simple. And even I have not told you many other microsystems, because just I want to give you introduction the how the acupressure system working in many places. So now I told you that each and every long bone is doing the representation of whole body. Now in our palm we are having multiple long bone. In our arm we are having multiple long bone. In our feet we are having multiple long bone. So each and every bone are doing the representation of whole body. So this is called bone microsystem. So let's make it simple. So let's see. As per the concept of acupressure, as per the concept of reflexology, we can divide the whole body in 10 equal parts. So let's divide the body from the middle. Let's divide the body from the middle. And 5 part we will do this side, and 5 part we will do this side. So why we are doing this? Because now we want to go ahead and we want to learn something, because there are lots of microsystem, but right now our focus how to work for the diabetes, which one is the best microsystem, and how can we work for the diabetes by using any microsystem. We doesn't matter. Ultimately we have to heal the patient. So now if we divide the body in the 10 equal parts, 5 in the right side and 5 on the left. So I am randomly dividing 1, 2, 3, 4, 5 here, but I will do it this division very systematically, shortly. And also I am dividing the whole body this side in the 5 equal parts. So look at this image. Now let's divide this head region in equal 10 parts. So this is the division from the middle. So this is the right half, and this one will be the left half. Now from the corner of eye we are making 1 point and drawing the straight line. From the midpoint of the eye we are drawing 1 more point and drawing the straight line. From the other corner of the eye we are again making 1 point and doing the straight line. So how many lines completed? 1, 2, 3 and 4. Let's make one last line here on the anterior border of the ear, where ear is ending. So these are the 5 lines on the right side. So let's give the name. 1, 2, 3, 4, and 5. Same division we can do on the other side. Now, suppose someone is suffering with the problem in this part, anywhere in this part. Means between 1 and 2. Then how can we work for the person? So now, let's go in the palm and see the how can we plan the treatment. Look at this palm now. Now, in the same way, first I will show you first I am going to show you 2 palms. So look at here. So we can divide the palm again in the 5 part. This is the part number 1. This is the part number 2, 3, 4. So 1, 2, 3, 4, and 5. Now it's become very simple. What is the simplicity now here? If the person having problem on the face, if the person is having problem on the between the part in this part, in the first part, then where we are going to treat? We are going to treat here because this is the part 1. So 1, 2, 3, 4, 5. So 1, 2, 3, 4, and 5. So this is the part 1. If the person having problem in the part 1, then we are going to treat here. How we are going to treat the person? Because first we should learn randomly, then gently and slowly we can learn very properly. So let's see now. So I am doing the demonstration here. Let's see now. So if someone is suffering, okay. So suppose this is the middle part of the body. This is the middle junction of the body. So this is the part 1. Then the second finger means part 2. Third finger part 3. Then the part 4 and the part 5. It means the problem of the nose side we can treat from here. Problem of the nose side we can treat from here. Okay, you need more juice. Okay, give me 1 minute. Is it clear now? Mr. Kamal? Okay, thank you. So when we are doing the acupressure here, so how to do the acupressure here?
Do your heart focus about it?
Adi? Okay. So when we are doing pressure here, our target to press this part because we want to treat the part just next to the nose. And remember, from the one hand, because right now I am holding the left hand, so I can only able to treat the left side of the face, remember. And if I want to do the treatment on the right side, then I have to take the right hand, but this is the left hand. Because this is the left hand, then I have to, means I am targeting the left side of the face. So the person is telling, can you treat my blocked nose? And I am having left side blocked nose. Okay, no problem. So this thumb side is the first zone, first area, which is treating the nose side. Then as soon as we go, we will reach to the eyes, and finally we will.
Yes, sound.
Oh, thank you. Sorry. Yeah. Okay. Okay. Thank you so much. Okay. So now if I want to treat the nose side, I will start pressing from here. I will keep my thumb here. I will start pressing from here. Now how to press? This is the rule of pressing. We never press with the tip. We never press like this. We never press like this. We have to press with the thumb pad. We will do the acupressure from the thumb pad. So we will hold this point and will press like this. Press 1, 2, 3. Press 1, 2, 3. Press 1, 2, 3. Now press 1, 2, 3. 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 So this is the treatment for the zone 1. And if the person, we are targeting the blocked nose, we are targeting the nasal polyp, we are targeting the sinus problem, then we have to focus on this zone 1. So we have to focus in this zone 1, and there is a formula of 1, 2, 3. What is the meaning of formula of the 1, 2, 3? I will tell you shortly. We have to press number 1 point, we have to press number 2 point, and this is the point number 3, which is called local point as per the microsystem. Now, suppose I want to treat the eyes. I want to treat the eyes. Then I told you the eyes are coming because this is the zone 1. So this is the zone 1. Now this is the zone 2, but our eyes are coming between the zone 2 because I will demonstrate you again. As per the microsystem, our eyes will fall here. Our eyes are going to fall here as per the microsystem. Because eyes will be between the zone 2 and zone 3 and zone 4. So eyes area will be till here. So suppose I want to treat the problem of the eyes, then I will treat whole this area starting from here till the here. So I will start from the index finger, then I will place here 1, 2, 3, relax. 1, 2, 3, relax. Press 1, 2, 3. Press 1, 2, 3, relax. Press 1, 2, 3, relax. Press 1, 2, 3, relax. And I have to give more focus here because this is the eye point. Then I will keep on pressing in this way. So as per this microsystem, because before doing the treatment on all the points, first let's clear the points so that we can make the clear marking between the points and we can do the treatment properly. So this was the just a random discussion. This was the just a introductory discussion how we can do the treatment. But when we are planning the treatment, we have to do the very systematic treatment, systematic. So today I am going to start the discussion of one disease because in this class we are going to discuss multiple diseases. So today my target to discuss about the one disease because many person has requested me diabetes. So let's start now. So let's see now. So when we want to treat the diabetes, first we have to press this point. This is called solar plexus, the center of palm. The center of palm, because center of palm is doing the representation of the center of the body. And when we want to work for the problem of the diabetes, so first we have to balance the central core of the human body. And the central core of the human body will be solar plexus. So what is the exact location of the solar plexus in the human body? Let's see this image. If we look at this image, so look at here. This is the sternum bone or the chest bone. Where the sternum bone is ending, so this is the place of solar plexus. This is the place of solar plexus. And this place is very important place because this is the core of the body. So for any disease, always we start our treatment first from the solar plexus. So how to stimulate the solar plexus? So we will go in the microsystem and we will stimulate the solar plexus. How we are going to stimulate? We will keep our thumb here, and with the help of thumb, with the help of pulp of thumb, we will press this point. So how to press? Press, hold till the count 1, 2, and 3, then release. Then again press till the count of 1, 2, 3 and release. And in this way, we have to press 15 to 20 times. So after the 15 to 20 times, the treatment on the solar plexus is completed. Then we'll move to the next point. So the next point will be for the diabetes, we always have to do, that is called dorsiflexion of the feet. This is the second treatment for the diabetes patient. Why to do the dorsiflexion? Because when we are doing the dorsiflexion of the feet, it is releasing the nervous tension. I will show you how to do the dorsiflexion. So I will show you how to do the dorsiflexion here. Because dorsiflexion is, we are not only doing for the diabetes patient, but we are doing the dorsiflexion for all the patient who is having any types of nervous tension, any types of stress, anxiety, and any types of nervous tension. So how to do the dorsiflexion? Look at in this image. So look at here. We will hold the feet like this. Okay, now it's okay, fine, okay. So we are holding the feet like this under our palm. So we are keeping our palm below the feet like this and holding the palm like this. Then giving the support of other hands on the top of the fingers, top of the toes, and gently pulling the lower hand, pulling this lower hand towards me and the feet on the opposite side. So look at here. So pull this side and this side. This is called dorsiflexion. So this dorsiflexion is very good to release the nervine tension, and for the diabetic patient and for all patient having any types of stressful nervine tension, we have to do this. Ekdam relax kar do. So we can do this one by one. or we can do in the both feet together. So let's see now. 1, hold for 6 seconds, release. 2, hold for 6 seconds, then release. 3, hold for 6 seconds, then release. 4, hold for 6 seconds, then release. So we have to repeat this 6 times. After doing from one feet, now we are moving to the other feet and doing the same. So now hold the feet with the one palm, do the traction with the other palm. So 1, hold for 6 seconds, release. We can do this exercise, we can do this technique for any patient having stress, anxiety, insomnia, sleep disorder, any types of nervous system disorder. So we have to do this 6 times. 1, 2, 3, 4, 5, 6. Even we can do both feet together like this. But when we are doing on the both feet together, the bottom grip is not that much perfect. And the person is not feeling that much nice. If we hold the feet, then the receiver is feeling very, very good. So this is the first point, which is called dorsiflexion, to release the nervine tension. And the second point for the diabetes will be, let's see now. The second point for the diabetic patient, breathing exercise 10 minutes. This exercise will be done by the receiver. Even we can help the person. Even we can help the person for this exercise. So how can we perform this exercise? So this is the 10-minute exercise, and we are keeping our hand on 2 places. One will be on the navel. So one hand will be on the navel, and second hand will be near about 10 finger below from the throat pit. 10 finger below from the throat pit. So this is the place in the Marma Shastra. This point has been told Nair Marma in the Marma Shastra. I will tell you once again, we have to keep our hands at 2 places. One hand will be on the navel, and second hand will be on the solar plexus. You can consider this solar plexus. So one hand will be on the navel, and second hand will be on the solar plexus, and just let it be there for 10 minutes. But sometimes 10 minutes become too much. So what we can do for 2 minutes and guide the patient. He can do more 8 minutes. So we will complete the breathing exercise for minimum 10 minutes. It's a very mandatory exercise to relax the system. So let's see how we are going to do this. I will do the practical demonstration for this. So in this exercise, our one hand will be on the navel, very gentle and baby touch, and one hand will be on the solar plexus, like this. And what we have to do, we don't have to manipulate, we don't have to press, just we have to tell the receiver, we have to tell the patient, let your breathing calm down, because our all the stress, our all the problem, we can notice from the breathing pattern. So if the breathing is very deep, and long, it means person is very going toward the health. The person is going toward the health, but if breathe is jerky, it means there is a problem. So as per my experience, when we are keeping our hand here like this, after 1 minute, the breathing is slowly and slowly calming down and the person is calming down. So after completing the 2 minute, even I can tell the person kindly fold your both the legs. Can you fold your both the legs? Yes. So many person are very much comfortable in this posture when they are keeping folded leg. If it's comfortable for me to do for 10 minutes, it's really very great dealing. It's really very good. But if it is not possible for me to do for 10 minutes, then I will take the palm of the receiver and will keep on the abdomen and other palm on the solar plexus. Then I will tell the person, okay, we in this condition with the folded leg, look at the leg. With the folded leg in this condition for minimum 10 minutes, do not give any pressure. Do not do this posture with the force. Just do it very calmly in very relaxation mode. So this is the breathing exercise which is mandatory for the diabetic patient, because diabetic patient cannot be cured just by medicine and just by some simple technique. We have to relax the system of the diabetic patient. Then only we can work. So this was the second exercise. Now we are moving ahead and let's see. Now we are moving ahead and let's see the third and very powerful exercise for the diabetic patient, because for the diabetic patient, our target, for the diabetic patient, our main intention to release the whole nervous tension and activate the parasympathetic nervous system. So the person, the vagus nerve get activated and the pancreas and the liver work very nicely. So let's see in this image. We can see in this image, these are the points between the knuckles. So these are the points between the knuckles, and these points are very deeply connected with our brain and nervous system. I have seen the effect of these points in many patients. The patient who are very tensionized, not able to relax, just while doing the stimulation on these 3 points, they are getting very good sleep in within few days only. So to release the nervous tension, this will be our next exercise or next point. We have to stimulate these points. So how to do that? Let's see now. Now I will tell you how to stimulate these points. So look at here. Okay. Okay. So our main point will be in this knuckle. Look at this knuckle area. So the point will be in this knuckle area. These are the point for nerve tension. Then the question comes, how to stimulate these points? So the very simple things, we can stimulate the points. Why our thumb, placing the thumb like this? Keep one thumb here, other thumb over the first thumb. So press and release 15 to 20 times. Then here, press and release 15 to 20 times, and here, press and release 15, 20 times. But we can also tell the person, do like this, and with your fingers, press this point like this. With your own finger, you can press this knuckle. So one time this side, second time this side. So the person can press these point himself or herself. So like this, press, 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 press. Okay. So these are the very good stimulation of these 3 points, because these points are very good to release the nerve tension. Very good points. In the acupressure system, these point has been considered very great point for pancreas. And I think you will be knowing what is the functions of pancreas. What are the functions of pancreas? The function of pancreas, there are 2 functions of the pancreas. The number 1 function of the pancreas is controlling sugar. A number 2 function of the pancreas doing the digestion of protein, carbohydrate, and fat. Pancreas is secreting three enzymes. The enzyme number 1 is amylase. Enzyme number 2, trypsin. And enzyme number 3. Enzyme number 3, who will tell the name of third enzyme? No. Peptide, we are asking enzymes. Peptide is the product after digestion of protein. Pepsin is secreted in the stomach. We are talking about the trypsin. So we have to remember the formula LAT. LAT, lipase, amylase, and trypsin. So LAT, there are 3 enzymes secreted by the pancreas: lipase, amylase, and trypsin. The lipase is for the digestion of the fat. If your lipase is good, then you will not assemble lots of cholesterol, unwanted fat, unwanted belly, because lipase is doing the digestion of fat. Amylase is doing the digestion of carbohydrate, and trypsin are doing the digestion of protein. So pancreas is having tremendous power. No any gland having that much power who can digest the protein, carbohydrate, fat, all 3. Like if you talk about the stomach, there is only digestion of protein. If we talk about the liver, only digesting the fat. But when we talk about the pancreas having that power to secrete the 3 enzymes who can digest protein, carbohydrate, fat, all the 3. And the 4th function of the pancreas, controlling the insulin. So when we are stimulating this knuckle part, these are the very wonderful points for stimulating the pancreas. So just by doing this acupressure, we can activate, we can stimulate the pancreatic gland. We can secrete all the 3 enzyme LAT, and we can also secrete the good amount of insulin. What is time right now? Okay. So in this way, this is our second point which we have to stimulate. That is the, I will write down, don't worry. I will write down. So you can look at, write down here. So look at here. So this point has been proven a very good point for stimulating the pancreatic gland. And with the help of pancreas, they are doing the proper secretion of LAT. L means lipase. A means amylase. And T means trypsin. So there are 3 enzymes secreted by the pancreas, and these are the very good point for the digestion, for the bloating, for the unwanted heaviness in the stomach, because with the help of this point, we can activate the pancreas. And when we will able to activate the pancreas, we will do the proper digestion, as well as we will able to control the glucose, because pancreas is the main gland who is controlling the glucose. Okay. So let's proceed ahead. Now there are too much we have to discuss about the pancreas. So I think enough for today, because today was an introductory session, and during this 15 days workshop, we have to discuss many diseases and the customized protocol of the many diseases. Today, many person has requested to tell something about the acupressure. So we have taken the introduction, and this class will be on Monday, Wednesday, and Friday. So thank you, Bodhigaya team, for providing this opportunity, because we most of the time we are just doing acupuncture, 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 but in this course we are working with more on acupressure. Okay, so thank you so much. We will 2 days we are having free classes for everyone, means Monday and Wednesday. Then class will be Bodhigaya participants or enrolled participants. Okay, so if anyone having any doubt, you can, we will give you a chance in the next classes. So closing the session now. See you on Wednesday. Thank you so much.